for best lay terms,
Sure.
what was his issue?
Sam was having vocal bleeding. He was touring in the South Pacific, in Australia, that area of the world, and had been noted by two of the surgeons there to have had multiple bleeds. So in that scenario, you're usually moving towards a procedure to stop the ongoing events. When a singer has vocal bleeding, it's somewhat unpredictable once they heal when the next bleed will occur. We sometimes say, okay, wait, if it's only happened once, and let's just follow it. But having had sustained it twice in a reasonably short period of time, thought the best thing to do was just have it taken care of.
And what causes that?
It's simply trauma. What often will occur is singers have normal frailties. They get a cold, they've had to do a little bit too much, and then still have to get on stage. It's misunderstood when people think that these are not expert singers. In fact, they're quite expert, and their opportunities and the densities of their schedules is what elicits it when they just get normal events. If you or I have a cold, we might go to work a little bit hoarse, the day doesn't change, your vocal cords are a little swollen. Trying to perform in front of thousands of people at your highest peak performance when your tissues simply are not ready, it'll often induce the event. And once there's an abnormal vessel, it just didn't heal exactly the same, it's predisposed to breaking again. So these things are called varices and ectasias. All it means is they're completely benign. Those vessels never completely healed well, and they have, like I said, a tendency in stressful, a lot of collision issues when people are singing at full voice to rupture again.
Yeah. So it's that wear and tear.
It's wear and tear, and it really is the resourcefulness of these folks to even be able to perform when they're sick. It's those skill sets that allow them to get on stage that often lead to the injuries.
And it's not surprising that he's so young.
No, I mean, we've had any number of other singers, similar situations, and vocal bleeding isn't just singers. If an individual simply had 8 or 10 hours of teaching to do, and they got a cold, and they're certainly not going to stop if they don't have to have the responsibility of getting on stage. They're going to get to their classroom. They're going to do other things. They have to be in meetings. They're all a whole range of individuals who will get vocal bleeding. I think it's fair to say people who get vocal bleeding are rarely timid and shy. They use their instrument. That voice and that set of vocal cords is a key part of their lives, but it doesn't necessarily mean they have to be a singer.
And in Sam Smith's case, what did you have to do to repair it?
So one of the things that I introduced a number of years ago was something called a KTP, or green light laser, for uses that had not previously been explored. The laser itself, the etiology, the genesis of this was through a gentleman who's a close colleague, Rox Anderson, here at the Mass General. And he was a leader in how these lasers would be used for infants who had vascular malformations, the babies with port wine stains. And as we collaborated, he and I looked at it, and baby skin was like a vocal fold. It needed to be supple and pliable for different reasons, but the pliability was important. And so one of the great things about this green light laser, or the KTP laser, is it could be pulsed for short periods of time and take care of the baby's skin, the vascular areas, without burning the baby's skin, without the collateral heat. So eventually started using this to manage a whole range of vocal cord problems. What it's most known for us is actually treating cancer of the vocal cord in such a way we've gotten the best voices to date that have probably ever been achieved while doing this in a matter of an hour, hour and a half, and avoiding radiation. In this situation, think of a device that, when calibrated one way, can treat the worst problem of all, cancer, and then recalibrating the settings can treat the most delicate, tiny microvessel, and then help a singer go on for years without ever bleeding again. So it's an amazingly versatile instrument.
So for this kind of procedure that you did on him, on Sam Smith, then the laser does what job?
Okay, so what you can imagine is a speculum is used in the mouth, and this is an instrument that I designed and patented when I was very young, and it's a gateway to get from the mouth to the vocal cords, which are over here. Then there's a surgical microscope, so it's very magnified, and you're looking at these tiny vocal cords, and then through the speculum, you will actually bring in a glass fiber, and the fiber itself is so small, it's like a hair, it's less than 1/3 of 1 millimeter. And that glass fiber emits a green light, and when the green light flashes, the blood in that tiny vessel coagulates and the vessel seals off, and the vocal cord is not burned at all. This is very different than the conventional lasers, like a carbon dioxide laser, which just actually cut and heat anything in front of it. This green light goes for hemoglobin or blood, which is why it was used for the baby's skin. So just like the baby's skin, you could treat vascular malformations of a vocal cord yet not hurt the tissues. And if it's like a cancer and there's more blood, you could actually bring more heat into the cancer and not the normal vocal tissue. So it became remarkably resourceful.